Teenage pregnancy has always been a social problem in the United States. Teenage pregnancy rates are declining rapidly. 44% has dropped from 1991 to 2010. In this video, we will be informing you all on what may cause teenage pregnancy, the rates of teenage pregnancy over the years, and how the numbers vary by race. We will also be going over some advantages and disadvantages that certain policies have towards teenage pregnancy. In the year 1991, African Americans were ranked number 1 in having the most teenage pregnancies. Looking ahead, in 2010, Hispanics are now ranked number 1. Asian and Pacific Islanders always had the least number of teenage pregnancies. The relationship between academic failure and teenage pregnancies are very close. That is why it is very important for teenagers to stay in school for a longer period of time. 89% of women that did not have teenage pregnancies have a high school diploma, and only 51% of mothers that had teenage pregnancies have their high school diplomas.
There were 2 policies researched in this area to assist pregnant teens. 2 policies researched in this area were Appendix J, issued by DCFS to the Pregnant and/or Parenting Program, as well as the services delivered by the Department for the Youth and College Vocational Training Program. The first policy researched was Appendix J, issued by DCFS. This policy was started after DCFS was sued for not providing the proper services to pregnant and parenting teens who were wards of the state. The case went to court and was called Hill v. Erickson Decree. DCFS wrote up a policy and procedure in 1996 to solve these issues and to ensure that pregnant and parenting wards of the state would receive proper assistance and care for their children. The policy requires caseworkers to provide information and support to their clients. It also provides prenatal care and comprehensive service plans for youth who are pregnant or parenting. This policy addresses many disadvantages. It addresses the population of pregnant and parenting teens who are wards of the state. Many of these teens are behind in school and have educational disadvantages. Much of the disadvantages are centered around teens because they lack many important resources such as daycare, proper assistance on prenatal care, parenting services, and there is a huge lack of family support among the clients. There are many drawbacks of the policy in this program. One of the biggest issues is lack of funding. The state is very limited on funding, so there is always a possibility of budget cuts on the program. Another huge issue is at the age of 21, the clients are emancipated from the program and they lose all the resources this program provides them with. There are many ways to overcome some of these disadvantages. A client can always meet with a mentor if they need more assistance and resources after they turn 21. Mentors will try their hardest to plan out their client's future and find other available resources. Clients can also become involved in community resources, or they can help fundraise for the program. The second policy found was the services delivered by the department. This policy was issued by DCFS to the Youth and College Incentive Program. DCFS wrote this policy and created this program to encourage teen parents who are wards of the state to attend college. The program functions in a way to help wards of the state attend college by offering them a monetary incentive. The wards of the state must apply through DCFS. They must enroll in a college of their choice and complete their FAFSA. Once they are in the program, they have to maintain a C average and submit a copy of their grades to their case manager. If they have successfully completed all of these requirements, DCFS issues them a check for $475 monthly. They are allowed to be part of this program until the age of 23 or until they complete college. There are several disadvantages to this policy. It addresses wards of the state who are pregnant teens and parents who want to attend college but cannot afford it. Many of teen parents are struggling and do not have many resources available. This program reaches out to these teens so they will be able to attend college and are given a monetary incentive. It also reaches out to the population of teen parents who live in impoverished neighborhoods with minimal or no good schools around them. It allows them to go to school of their choice and complete college. Another disadvantage of this policy is it requires students to attend class frequently and maintain a C average. However, this is particularly difficult for teen parents because of the challenges they face daily. This policy does not offer daycare, so many students miss class or do not do well in class because of the daily distractions of caring for their children. Also, the students must be responsible and submit their paperwork and grades to their case manager. If they do not, then they are terminated from the program. It is also difficult for these parents to attend school full-time. Not only does this policy not offer daycare, but many of the students lack family support. There are many distractions in teenage parents' lives which make it difficult to successfully complete school. The biggest disadvantage of this policy is it does not address disabled students. There are many teen parents who are wards of the state that suffer from mental disabilities. However, unfortunately, they do not qualify for this program. Finally, there are some ways to overcome some of these disadvantages. Students can try to find resources available in the community to find a daycare center that is affordable. They could also use some of the money DCFS issues them to pay for daycare so they can attend class.
The National Campaign to Prevent Teen and Unplanned Pregnancy was founded in 1996. Their mission is to improve the lives and future prospects of children and families, and in particular to help ensure that children are born into stable, two-parent families who are committed to and ready for the demanding task of raising the next generation. The National Campaign uses a combination of responsible behavior by both men and women and responsible policies in both the public and private sectors. The goal of the National Campaign is to decrease teen pregnancy and unplanned pregnancy predominantly amongst our teens. Lowering teen pregnancy can reduce child poverty, reduce taxpayers' burdens, help ensure healthier pregnancies, healthier babies, enhance child development, and have healthier future generations. The National Campaign uses different types of methods to reach our teens. They raise awareness of the teen and unplanned pregnancy problem by working with opinion leaders, the press, popular media, policymakers, influential organizations, and program leaders at the national and state levels. The National Campaign engaged parents, faith communities, young adults, teens, and others. They encourage increased discussion about the role that responsible behavior can play in reducing both teen and unplanned pregnancy. The National Campaign conducts action-oriented research, public information, and education. They emphasize the role of men in pregnancy, prevention, and planning. The National Campaign is a non-profit private organization, and most of their funding comes from private donations. The majority of their funding comes from the William and Flora Hewlett Foundation. Some other donations are from individuals and organizations such as Johnson & Johnson, Southwest Airlines, Kellogg Foundation, Public Welfare, and many, many more. The National Campaign is unique because they work with entertainment media and other influential people and the latest trends. When assisting teens, they listen to their points of view and recognize their strengths and use them. They also work with powerful and influential organizations. The National Campaign uses lots of research and data to prove their actions. They want to change the way that people view teen pregnancies, and they also support anyone who is advocating for teen pregnancy by conference calls, access to the latest research, and information. They highly recommend and assist parents in the importance of speaking to their children about safe sex and the pros and cons. They recognize that some people come from faith-based households and use those beliefs to help teens and unplanned pregnancy. The National Campaign have had many successful results all around the world. They have appeared in more than 6,000 newspapers nationwide, and they also developed the nation's definitive assessment of which community programs help to reduce teen pregnancy. The National Campaign encouraged 3 million teens to participate in their annual online National Day to Prevent Teen Pregnancy. The National Campaign is a very different organization than many others. They don't promote sex, however, they promote safe sex. Many organizations promote abstinence, which may be the best option to avoid pregnancy or any sexual transmitted diseases. However, times have changed and many teens experience sex at a young age. So promoting safe sex to me is a great option. Many children are not aware of the consequences or the effects that it may have on themselves as well as their families. The National Campaign teaches teens to wait till they understand the true effects. They educate teens about pregnancy, about STDs, and the effects they may and will have. They understand that teens will make their own decisions, however they guide them to make the right ones. The National Campaign has an informative website for teens, adults, and parents. You may also request information and tools you may need to speak to teens about our teen pregnancy. They also have special focuses like male involvement, Latino initiative, colleges, and the National Day of Teen Pregnancy. The National Campaign recognizes two major factors. First, 3 in 10 teens get pregnant by the age of 20. The rates in the United States are still the highest among the nations and after 15 years of continuous decline. The U.S. teen birth rate is still on the rise. Second, teens have been making remarkable progress over the past 2 decades. Adults have not. Half of pregnancies are unplanned. Advocates for Youth was established in 1980. They focus on young adults between the ages of 14 to 25 in the U.S. and around the world. Advocates for Youth envisions a society that views sexuality as normal and healthy and treats young people as valuable resources. Advocates for Youth work with over 28,000 healthcare providers, educators, and other young serving professionals, directly and indirectly strengthening the ability of more than 9.5 million youth to make informed, responsible decisions about sexual health. Advocates for Youth is one of the first organizations to put adolescents' reproductive and sexual health needs on the agenda of the international family planning field, establishing the International Clearinghouse on Adolescent Fertility in 1980. Advocates for Youth were one of the first mainstream organizations to recognize the potential dangers of HIV for adolescents, sponsoring a groundbreaking national conference on AIDS in adolescents, among other HIV prevention initiatives, as early as 1987. In 2001, advocates began to frame the sex education debate in the larger context of an assault on public health science through the development of its use of its ideology versus science framework. Advocates helped demonstrate how abstinence-only policies had evolved into anti-contraception policies with major impact on teen pregnancy and HIV prevention in the U.S. and abroad. Advocates for Youth offer different types of programs, which are HIV prevention, future of sex education, school health, teen pregnancy prevention, public information services, and many more. Advocates for Youth staff provides training sessions on these topics that are related to sex education. Evidence-based practices and promising approaches to promoting adolescent sexual health, reframing sex education to promote positive and healthy messages and behaviors, parent-child communication, using media as a partner in sex education, healthy adolescent sexuality, and European approaches to adolescent sexuality. Advocates for Youth works with many different organizations and receives their funding by donations, grants, and federal funding. The National Campaign for Teen Pregnancy and Unplanned Pregnancy, as well as Advocates for Youth, are 2 programs that focus on educating teens on sexual health, as well as advocate for teen pregnancy.